Hello, I'm Dr. Sean Kelly, Chief Medical Officer at Imprivata. I'm also an Assistant Clinical Professor of Emergency Medicine at Harvard Medical School. As a practicing ER doctor, I see the impact of the opiate crisis firsthand. The number of opiate overdoses has skyrocketed in the past 20 years. And as such, a number of initiatives are underway to combat this crisis. As you may know, one of the tools used to stem the opiate crisis is electronic prescription of controlled substances, or EPCS. Walmart announced that it will only allow EPCS in its pharmacies starting on January 1st of 2020. Additionally, EPCS mandates have been passed at both the state and federal levels coming into effect over the next few years. In fact, the state of Virginia has mandated electronic prescribing of all controlled substances with an effective start date of July 1st, 2020. Now that healthcare organizations are required to do e-prescribing, it is important for them to comply with the DEA regulations put forth in the interim final rule in 2010. In order to stay compliant with EPCS regulations, organizations are required to follow unique and complex requirements in order to ensure the privacy, security, and non-repudiation of those electronic prescriptions. ID proofing, logical access control, two-factor authentication upon authorization of a prescription, and auditing and reporting tools. It's very important to keep all of the DEA regulations in mind when being compliant with an EPCS solution. Keep in mind that if your organization plans on using a traditional token vendor for EPCS compliance with the two-factor authentication regulation, you may need to put into place disparate or even manual processes to maintain compliance with all of the other DEA regulations that are still required. Imprivata Confirm ID is a comprehensive platform for meeting DEA requirements. We've helped hundreds of institutions like yours from across the country to implement EPCS solutions. We have an in-depth knowledge of electronic prescribing of controlled substances and the DEA requirements associated with it. Please contact us if you need advice regarding your current EPCS deployment or if you're considering a solution. If you'd like to be connected to the Chime Opiate Task Force, please reach out to me. Thank you for your time.